Welcome everybody to the Finance and Revenue Committee meeting. It's hard to believe, it just occurred to me that we've been doing this for a year now. Time flies when you're having fun, right? So today's the day we're going to vote on our preliminary proposal. So I just want to note there's been a lot of work. I also want to especially thank Charlie and Richard for all the extra work you've been doing with Echo Northwest. Appreciate you. And I also want to remind us all that this is really great work, and it's a draft straw proposal, so let's not let the perfect get in the way of the good. So with that, we'll do roll call.
Perfect. Okay, Cheryl Ramirez.
Here.
Thank you. Chunwei Chi, I know can't be here today. Mary Lou Heinrich. I see you, but
Yes.
I don't.
Yeah, it's Henrich. It's Henrich and
Henrich.
Henrich, just plain old Henrich. Okay.
Writing it down. Thank you. Richard Gibson.
Here.
Thank you. Jeff Goodman.
Here.
Thank you. John Santa, I know couldn't be here today. Bethany Stairs.
Here.
Thank you. And Charlie Swanson.
Here.
Thank you. That's everyone.
Thanks, Isabel. So we're going to review the agenda, and then I believe we're going to have a special session of public comments before the vote. So we'll quickly review last meeting follow-up, give you some board and committee updates, and then circle back to a couple of topics that we need to discuss before going into the preliminary proposal, distributional analysis and operating reserves and transitional costs. Then we'll really get into the revenue options preliminary proposal, and we'll split that up into two sessions. We'll first go through the proposal, then we'll take a little break, and then after the break we'll finish up the discussion and vote. And then, as usual, meeting reflections, next meeting topics, and then another opportunity for public comment. So that's the agenda. Okay, we're doing previous meeting follow-up before the public comment, Mimi?
No, we're going to have public comment and voting topics. We just didn't get a chance to
Oh, okay. All right.
switch the agenda. So
okay, let's go to the public comment then.
Great. So this is same sort of spiel as always, but because we have a vote today, we have the opportunity for members of the public to give public comment prior to the vote, specifically related to those topics. So we have a few people signed up to do that today. I'm just giving them permissions to participate, but yeah, as always, we really appreciate people's engagement with the work of the committee and sharing their public comment. So yeah, we'll have about 2 minutes per person to speak, and we ask that people, kind of wind down when that timer expires if possible. So with all that being said, the first person who is going to be giving public comment is Alex. So I will hand it over to you, Alex.
Can you hear me okay and hopefully see me okay?
Yes.
Awesome. I can't see anybody on here, but so be it. So for the record, my name's Alex Polikoff. First, I want to really thank the work of the committee, and especially Charlie and Richard. I mean, they've done really yeoman's work on working with Eco Northwest on this core revenue preliminary proposal. Just to get right to it, I would just really like the committee to reconsider the use of the personal income tax credit for the employee payroll tax. I understand the desire expressed by Charlie especially to double tax wages, but going back without repeating it completely, I just really agree with the comments that Linda Krieger posted to the committee on this in the September 2nd meeting materials. The biggest issue for me that I see is, for a lot of businesses, this is going to be, more than triple their payroll tax. And I think you're going to get a lot of pushback from businesses. I mean, I like the fact that it's and I wish it was just a firm payroll threshold, not an individual wage threshold. I like the fact there's a threshold there, but any business with more than a few employees is going to see a huge increase in their payroll tax, and businesses on tight margins, are really going to push back. Large employers are going to be happy with it, but not so small businesses, which makes up a lot of the business community. And plus, it results in a higher premium and personal income tax. The fact you're crediting that back, there's already been some public comment on pushback on that, along with premiums. I think in order to sell this, you're going to have to decrease that, because negative ads and social media is going to concentrate on the maximum. Most people are not going to be looking at the tax calculator, which I think is great and necessary. But most people will not be looking at that, and I think that needs to be kept in mind. Anyway, I'm out of time, so thank you to the committee, and I'll yield to the next person.
Thank you, Alex.
Thank you, Alex. And next we have Linda.
I'm going to just jump right in too. Unfortunately, I didn't have very much time to review the preliminary UHP funding plan, the straw proposal. But I did, in looking at it this morning, I noticed a couple of issues with it. One is that in the figure 1 parameters of the proposed revenue plan shows an employer payroll tax of 11.3%, but in the narrative it shows 11.7%. And in the individual contributions, it shows 9% for the HCPIT, but in the narrative, it says 12%. And the reason why that makes a big difference is a Nike executive making $250,000 with the credit, because the EPT is higher than the individual HCPIT, they will pay nothing toward the UHP. They will make no contribution. And in fact, if the credit can be applied toward other tax, not just the HCPIT and the individual PPP, they will get an additional $3,694 tax credit against other taxes they pay in Oregon. While a small business employee who makes $47,000 a year and their employer does not pay the EPT, so they get no credit, they would actually have to contribute $5,603 a year. That's under the proposal that's in the table on page 7. So I did that quick math. I can show it to you, but did that. Now, if the employer payroll tax is greater, is less than the individual HCPIT, then the Nike executive, so if I use the 12%, the Nike executive contributes $2,158, and the small business employee contributes $6,138. That's all.
Thank you for pointing out those discrepancies, Linda. It's something we need to address for sure.
Thank you, Linda. And then finally, Lou, I wanted to confirm whether your public comment today was related to the vote or for general public comment.
No comment.
Okay, thank you, Lou. That's everyone.
Thank you, Isabel. Now we'll go into the previous meeting follow-up, so I'll hand it over to Mimi.
Great. Charlie, you have a hand raised?
Yeah, I just wanted to respond to one of the comments, and that is that the intent currently is that the credit for the EPT is non-refundable, and it only goes towards the HCPIT, not towards any other tax liability. So just to make that part of it clear. And another piece related to the comments, I think quite a few of the discrepancies in the various numbers have been addressed in later revisions to the document, and they were changed a number of times while we were creating it, so they might still be there, but I think what our proposal is going to be is a 11% EPT and a 9% payroll tax, but I'm not sure if that's quite where we landed, but we did see some of those discrepancies, and at least in some versions they've been corrected. So
Thanks,
stop there.
Charlie. Thanks for clarification, and we'll have to just take a look when we go through the proposal just to make sure. Thanks.
Right. All right. So good morning, everyone. This is Mimi McDonald, Executive Director of the Universal Health Plan Governance Board. I will be brief. I wanted to talk about some topics that we had left over from our last meeting that aren't like specifically regarding the content. So first off, we discussed the potential for having an additional committee member on the Finance and Revenue Committee. There was a recommendation from the committee that there would be a person with clear understanding of the revenue proposal be available at upcoming engagement meetings as well. There was a desire to have a simplified version of the revenue proposal and a request, which is, so the simplified version is sort of the Universal Health Plan Governance Board proposal in addition to what you will see is the Echo Northwest memo. And then there's a request for further explanation of the tax credit in the revised memo, which indeed there is. So I'll just stop there and ask if there are any questions about that follow-up. Jeff Goodman.
Thank you. The comment about the desire to have the simplified version of the revenue proposal, that was something we all agreed upon several months ago to include in our report, either a cover page or somewhere in the report, a one-page summary of the inflows and the outflows. And so that's something, this may be a comment, maybe be premature about our draft, but the opportunity came up, so I'm chiming in on that. One-page summary, inflows and outflows.
Thank you. Thank you very much, Jeff. All right, next slide, please. Again, and for a brief roundup of what's been happening at the board. At the last board meeting, there was an update from a Milliman consultant group about their work plan. There was a great review of hospital payment systems by staff member Lee Hastings. And then we had updates on the community engagement and communications committee and the operations work plans. Those updates were approved. There were not any straw proposals approved at that board meeting, but we do anticipate at this next board meeting, which is on the 16th of this month, that we will be going over certainly this revenue plan and some other straw proposals as well. Communications committee, as you can see, they're continuing to, they have completed the work plan. They've completed the strategic messaging guide. The one pager, which is, there is a basic one pager, which to be told, it might be more than one page, and also a detailed one. Those have been completed, and they're currently sort of in the finishing production mode right now, and then working on those plans for targeted strategic engagement meetings. So that's kind of what's in development at CECC. Plan design and expenditure, hospital payment models have been discussed a few times, and at the next meeting, we anticipate having at least, if not necessarily a proposal, but just sort of some recommendations to be included in the final report. We also had a guest speaker, which was great. Our very own Cheryl Ramirez came and helped us out discussing behavioral health payment models, and we were incredibly grateful to her for that. And then a quality strategy preliminary proposal was put forth. There was lots of great discussion around that. And so that proposal is actually going to be revised. It's going to go back to PD&E before it hits the board. And then lastly, Operations Committee. There was an administrative structure and a discussion around regional entities. That proposal was actually approved and will be going toward the board at this next upcoming meeting, and just beginning to start talking about startup costs, including reserves and surplus. So I'm going to stop there and see if any of our board members have anything else they'd like to add. Jeff. You can go ahead, Jeff.
Thank you. Not a board member, but I watched the recent communications meeting, and the question came up as to what happens if we do not get a Medicare waiver. And nobody had an answer for that, when the answer should have been, without the Medicare waiver, our plan does not go forward. So I think that just needs to be communicated to them so they're ready and have that information.
Thank you. Charlie.
I would revise what Jeff just said a little bit. So there's another way that many of us think you could deal with Medicare, and that is by the state becoming a Medicare Advantage insurer. And so I think that that's another method. That's something that the task force looked into, and I think it's a good possible way to include Medicare without a waiver. So I just want to revise what Jeff said a little bit, at least in my opinion, that could be a good way. And I also think that the task force thought that it could be a good way as well.
Yes, thank you. Certainly what the work that the CECC committee has done has been very basic, so there aren't specifics of the plan involved, and certainly they will only be sort of rolled out when final decisions have been made. So thank you. And I am finished. Thank you so much. And we'll turn it over to our friends at Echo Northwest.
Great. So this is Morgan. I get to be first up here. So we're going to give you a bit of an appetizer before we get into the main course of discussing the straw proposal, and mostly just making sure that we warm you up a little bit, but also cover some topics so we don't run out of time on the back end of it. So here, what I want to be able to do is preview a couple upcoming topics and take some questions, comments, and direction, advice from you about things that you would like to see specifically that would help you kind of understand some of the specific work coming here. And why won't my Zoom show me my share? There it is. Weird. Okay. Great. So the two pieces we're going to cover here are, okay, great. Are one of the key pieces of the work that we've been kind of holding off on as we've been working on what I would call kind of the philosophy of the revenue target work that you've been doing. And but I think it's been implicit, and we've been showing some of this stuff at a high level so we can understand some of the broad maneuvers. But part of the here is, now that we're coming close to having something fairly fully baked, we want to do a deeper analysis of the distributional impacts. But then also, one of the key remaining agenda items for the group is to weigh in on a funding and financing plan for funding operating reserves and transition costs. And so my colleague, Sarah Emmons, who she will introduce herself in a little bit, will cover that piece. So I don't want to take too much time, but I think the mechanisms in place here that the straw proposal rests on are primarily the employer payroll tax, but we're also tapping some small marginal increases in the corporate income tax as well as the corporate activity tax. And on the individual side, we are looking at the new healthcare personal income tax as well as the personal premium revenue approach. You are all familiar with this chart where we look at sort of pre and post total spending amongst groups here, private employers and local government, federal government, and individuals. But what we want to make sure we do on the distributional side is try to dive at least 1 or 2 layers deeper to understand on the business side kind of how our business is currently paying across these things in the sector side, and how might they change, how might that healthcare spending and funding change under the UHP plan. And so I just want to kind of give you a quick sort of overview. So one of the first things, right, with the corporate income tax, right, it applies to all companies with income and an organ source. So that's the nexus rule. And the rate here, right, is under $1 million is bifurcated, 6.6, and over $1 million is 7.6. There's some information provided by the Department of Revenue that Charlie is already sort of tapped in building his model, but we'll want to try to dive a little deeper so we can disaggregate it by industry type, and to the extent that we can by sort of business size. I think are those kind of the 2 key aspects of the sort of distribution that we want to spend some time thinking about. And so, go ahead, Charlie. You had a question.
So you did mention this just a moment ago about industry size. So to me, that's probably the more important piece is disaggregating it by size. And
Yep.
I'm hoping that you have that data. And as soon as you get anything related to that, hopefully you can share that with us. So,
Yeah.
but yeah, because that to me is the more important part.
Yeah, so I think given how we are structuring, and this is
Yeah.
I think what Charlie just highlighted, and I think I'll just be clear. On the business side, I think the 2 places where we can spend some time understanding distributional effects is on hopefully firm size, whether we measure that on sort of income, proceeds, revenue, right? Still a little bit TBD, or just employment or number of employees. Part of it here is like, what can we get our hands on in terms of information? But then also from a sector side. And so I think those are the kind of the 2 dimensions for businesses that we're spending the most time on, particularly given how we're structuring not just the income tax and the activity tax, but more importantly on the payroll tax. So the next thing, right, is a look at the corporate activity tax, right? We have some small percentage increase in the corporate receipts tax or corporate activity tax, and right, this is a sort of modified gross receipts tax, where we look at revenue above $1 million, less some sort of standard deduction, which is in labor costs. And you can hear is just a quick snapshot from the Department of Revenue, just distributionally, how that tax burden is falling on different industries, right? And this is just total receipts by firm, but I think what we want to do is try to normalize things like this to understand sort of both by size and by sort of on average rate, how do different businesses might the incidence of that increase fall? Okay, go ahead, Charlie.
So another question is for the retail trade and on the wholesale trade too, if you could also disaggregate based upon those that relate to food and medicine, that would be wonderful. So
Okay.
just another thing to look for when you're looking at the data. So thanks.
Okay, no, thank you. And Charlie's spot on. If the things that you're curious about sort of on the distribution side, do flag it for us as we kind of spend the next month here, several weeks kind of doing some analysis. Okay. Oh, I seem to slide got a little out of sequence here. I'll come back to it. The big maneuver in the proposal is through a payroll tax. And so we're already diving into this analysis to understand how, and I think Linda's question raised here around how might the payroll tax actually work and how it might fall across different kinds of businesses and potentially even sometimes of kind of pairs. So this is just a quick chart showing the current contributions of state and federal payroll taxes. And you can just see these are just total collections. But what we're going to want to try to do here is look at the current mix of this by firm size as much as possible, firm wage structure, so we can understand how the roughly 11% payroll tax is going to fall on different kinds of businesses. Go ahead, Richard.
What currently comprises the payroll tax, say at the federal level for these companies back to 2003?
Yeah, so That's a good question. So I think I don't know the whole time, but it's definitely Social Security, Medicare, and I think the big change, right, is sort of the unemployment insurance piece of this. There may be a few other things on the state side that I'm missing, but I don't know, Will, if you know off the top of your head. But we'll track that down, Richard, to sort of understand sort of what other components of the payroll tax are there. And so I'm guessing the question here is like, what would be kind of the combined incidence of a payroll tax in terms of like current law at the federal and state level, and then the EPT layered on top of it. Okay.
Are you asking if the FICA taxes are in this graph, Richard?
Yes.
No, he's just like, I mean, I don't know what the change in rate is going all the way back to 2003. So we see, obviously, I'm guessing the question, Richard, is we're seeing lots of fluctuation. Some of that is economic, as kind of total employment increases and total wages increase, but we have some sectoral pieces here. But I don't know whether there sort of also changes to the rates and in play here as well. But
Well, unemployment tax is very small, but FICA and half of Medicare is on the order of 9%. And we're talking about putting on another 11%. So it'd be more than double this if FICA and Medicare are part of that.
Yeah. Yeah. And then also, right, I think it's also important to understand that at least when we talk about sort of the contributions, the intent here is to substitute out, right, for current ESI payments. And so whenever we kind of look at that from a payroll perspective, we'll want to kind of look pre and post and kind of disaggregate not just sort of the payroll taxes, but the, total contributions, including current ESI payments. Go ahead, Charlie, and then Cheryl.
And to me, the numbers can't be right from if it's including FICA, because essentially FICA's got to be about 7% of, the employer part of FICA is about almost 7% of total wages. I mean, it's a little bit less because high wages are gone, and total wages are more on the order of 100 and some billion, and so
No.
this has got to be at least 7 or 8 billion. It seems like just in that. So I'm not. It can't be including the contribution to Social Security and Medicare.
Okay. Well, I'll go double check. I don't want to get hung up on the chart
Yeah,
here.
right.
It's
Yeah,
kind of
okay.
FYI, but yeah, we'll make sure that we're squared away on what the contributions are there. Go ahead, Cheryl. Oh,
Will your deeper dive and separating by business type and size of business, will that address the concerns that Alex raised during public comment? I just want to make sure we address those issues.
to some extent, because I think it's hard to model. I think at the margins, I think some of the issues that Alex raised are real. Whether or not we can get the resolution in the data that show kind of where you might have kind of these weird, I don't want to call them inflection points, but but the sort of the phenomena that sort of Alex pointed out, I don't know if we'll have that. So I don't want to sort of promise that, but I think to the extent that we have that data, I think the issue is real though, and I think Linda pointed to a few of these things from a global perspective that we'll want to kind of be paying attention to when we talk about the distributional side of this, because I think there's also kind of a the requirement in the legislation is just to look at it as it falls across different individuals and businesses. But I think there is also this sort of like equity principle that is harder to sort of then measure with some of these questions, particularly when people have can have very unique circumstances. But we'll be trying to pay attention to those.
Yeah, I think it'd be good for us to look at and for different sizes of businesses to see if there's huge disproportionality among businesses.
Yeah, but even then, I think even Linda and Alex's question for sure. I think at some of the smaller scale questions of like, well, what types of businesses may be, contributing more than they are today, and what are the implications of that versus businesses that are, potentially on the other side of that equation, right? Or,
Right.
maybe contributing less, right? I think it's harder. I don't know whether or not, I'll just say right now, whether or not the resolution of the data that we can use here can help make a real pointed case. But I think all to say is like we'll definitely include these issues in our discussion.
Okay, thank you.
Then just to quickly go back, right, then the on the healthcare personal income tax and the personal premium revenue, we'll be really trying to think about this from a, I would say, in currently the way we think about it, both in terms of adjusted gross income and household, and we using exemptions as a bit of a sort of proxy for household size. We'll continue to do that as much as possible, and then think about sort of the trying to figure out ways to incorporate sort of current healthcare spending, both at the premium and out of pocket side of things. So there's a few data sources where we can try to help approximate that, and then obviously then model the policy as it is being proposed. I will close with just one additional comment. So we've been meeting with the Legislative Revenue Office periodically during this time, since they maintain many models who, that when the legislature asks them to examine changes in tax policy, they also get these questions about the distributional effects of any different piece. And so we're working with them to sort of make sure we're using the best available information and data, as well as sort of thinking, given the constraints that we have on time and resources, to make sure that we're doing a reasonable and honest job of assessing these issues. And I'll just say, I think for the most part, and big kudos to Charlie, I think a lot of what Charlie has built in that tax model kind of represents a lot of really good thinking. We're just trying to kind of think of it, sort of bone that up as much as possible to sort of look at some of these other questions as well. And so that'll be kind of moving forward post this meeting. So we'll take all the comments. And if you have other things you want to float, please direct that through Mimi or Cheryl, and we can definitely embed that. But I imagine Charlie and Richard will, I'll volunteer you now. You'll continue to be involved as we advance those pieces of work with LRO and with this group. Go ahead, Charlie.
So another thing that we could maybe look at a bit is how much do employees pay for employer-sponsored health insurance at a wage level? Because one of the huge changes in what we're proposing from what's currently the amount that is paid for employer and sponsored health insurance is essentially the same for a low income, a low wage employee as a high wage employee. And the huge change that we're making is the companies would pay vastly more for a high wage employee, the healthcare of a high wage employee, than they would for a low wage employee. And so I'm not quite sure how we would want to quantify that, but looking into that change might be something that would be useful to put forward as well, as sort of a data analysis.
Yeah, I agree. I think, one of the things we've been noodling on over here is like how, what are the best sources of information that understand the sort of health, the employee, as well as the employer and employee contributions to health plans, and how disaggregate we get that by wage or employee type or by sector, so that we can kind of then sort of understand, sort of as we sort of move to a sort of move away from that system and towards a sort of general tax. How might we see sort of the effect of that across that current distribution? And so does it look something along the lines of what Charlie just articulated? Probably, but be nice to be able to kind of actually prove that out with as much information as possible. Okay, great. I'm going to pause here and see if there are any last questions on this further work item, but I feel like we've been kind of talking a lot about these pieces, and I think we have a good sense of the committee's piece, and we'll be continually to involve Charlie and Richard in these conversations as we move forward. So I feel like we should be well calibrated there. But if you have other things that you think are important for us to kind of be looking at, do send that along to either Mimi or Cheryl. Okay, great. I'm going to pause here and introduce my colleague, Sarah Emmons. Sarah, are you on?
Yes. Good morning, everybody.
Great. Sarah, why don't you go ahead and introduce yourself, and then let me know when you want me to advance some slides.
Okay, sounds good. For the record, I'm Sarah Emmons. I'm part of the Echo Northwest team, and I come from a government practice background. So I was a nonpartisan fiscal staff in the Washington State Legislature. I worked for the House Finance Committee doing tax policy, and then I moved over to the Senate side where I staffed Ways and Means, and I worked on non-Medicaid human services programs. Including serving as the senior fiscal analyst for the formation and implementation of the two large state-funded insurance programs, the Paid Family Medical Leave Act and the Long-Term Services and Support Account. And the Paid Family Medical Leave Act account actually went insolvent for a couple of years, or for a couple years into implementation. So I'm going to talk a little bit about the research that we're doing in ECHO, and I have some reflections on that experience as well. I also had the opportunity to serve as the deputy CFO at a large state agency that has dealt with growing pains following its formation in 2019, in large part due to very lean assumptions about the funding needed for operations and core infrastructure, as well as some overly ambitious assumptions about federal reimbursement for some of those costs. So we had to go back to the legislature a couple years in a row to ask for more money. And then finally, I was the policy director at the Pennsylvania Treasury, where I established fiscal policies related to intra-fund borrowing. So we'll talk a little bit about that toward the end of my talk, have some observations that might be helpful for this group as you consider financing your startup costs. So I, of course, have not worked on a program like UHP because there isn't one like it. And that's part of the challenge for this committee is how to define and set reserve targets for a unique program like this one. That's universal, that offers broad coverage of services that may in fact exceed what is typically administered by the state or by similar programs. And then, of course, this third bullet, very high visibility. This should apply to all public programs, but particularly when you're talking about the scale and magnitude of the dollars that we're talking about. Smooth implementation will be expected, and reserve funding is obviously a big part of that. So next slide, please, Morgan. Oops. Okay, so when we're talking about modeling or targeting reserve levels, there's two types at a high level, two types of approaches that one could take with an insurance program. So the first is more typical of insurance programs, and these are actuarially determined reserve amounts. I'm not an actuary, and I know just enough about this to know how little I know, but typically these are based in some calculation of risk, and they have a target level of coverage for, say, a catastrophic event or a high volume of claims, or some sort of target amount of expected benefit payment. So, for example, 3 months is what the Paid Family Medical Leave account uses. The second approach is a little bit easier for my feeble government brain to understand, and that's sort of more typical of a household budget approach where you have a percentage of expenditures or reserves on hand for contingency. It's very possible that our research and engagement with Milliman and direction from you all would point us in the direction of a policy that incorporates both types of targets. So this snapshot here is from the Government Finance Officers Association. It's actually not referring to insurance pools. It's more of a kind of government approach to thinking about reserves. But I like it because it kind of highlights the importance of both schools of thought. So, oh, go ahead, Charlie.
I just had a quick question. When we're
Yeah.
thinking about this, or when you're thinking about this, or Echo Northwest is thinking about this, are you including the possibility of reinsurance as well?
Yeah, definitely. I mean, this is kind of where we're just kicking off our research, but I think that is something that I know in typical insurance pools, when you have you get to a certain level of coverage and then you have a reinsurance that kicks in. What I don't know is if you have like the full faith and credit of a state government behind you, what level of coverage that would be needed. And this is where we'd want to talk to Milliman and look into other best practices. As you know, there really aren't very many precedents in the United States. So it's kind of trying to find benchmarks and corollaries where we can. So the two kind of schools of thought here are we have reserves as an insurance policy guarding against risks and revenue instability and cash flow instability, which is very possible when you have a new program that's reaching maturity, and also reserves as a savings account, which is more your typical government fund approach, where you are accumulating cash to pay for future costs, or as the case may be more likely in this with this program, repaying an intrafund loan for startup costs. So next slide. So some of the questions that we're looking into, and this is kind of gets to your question, Charlie, is how is UHP different from typical insurance programs? It's not purely actuarially funded. As we know, there's a very diverse revenue stream, which is great. It also means that those automatic adjustments you get in a typical like smaller insurance program with the contributions rising and falling and reserve targets recalculating might take several years to kind of get to the point where you have maturity and you can make those calculations. There's no prior history to observe trends in costs. So again, of course, those mathematical equations that go on autopilot at a certain point are not available to observe. Healthcare costs may escalate faster than some of the revenues that this group is looking at. And I say here, claims and payouts may fluctuate year to year. Of course, that should be they will fluctuate year to year. And especially in those early years, the reserve policy is going to be really important to make sure that there's a balance there to accommodate that. Another consideration is a timing consideration. So when should the reserve target, once that's established, be met? At launch means just another large upfront cost for the state. But at program maturity means there's some risk if you don't have that on hand as you reach maturity. So that's something that we'll be looking into as well. And if you have other questions you want me to add on, you want us to include on this slide in our research, I'd love to hear them. All right, yeah, Charlie.
I'm not quite sure what you'd all be looking at, but part of it would, I think you mentioned interfund transfers. Would that include bonds that were sold for the purpose of getting some money built up? So I guess I'm kind of wondering how the bonds would fit into this.
Yeah, I think it's not actually, we have a slide that's toward the end that has kind of 3 options, and one of them was a direct appropriation, but you could kind of put in there a direct one-time infusion from the state with repayment from revenues. So that we could definitely consider that. And I think the idea here is to sort of talk about what we're talking about operating reserves, and we're talking about startup costs. And then yes, like we don't have a target number in mind yet. So that kind of makes it like awkward to, bring financing proposals forward, but there are also options that we are looking at kind of on the proposal side that we'd love to hear from you all and your feedback on. I think a bond could be on the list as well. Mary?
I just wanted to comment a little bit on the dot point number 3, healthcare costs may escalate faster than revenues. I think in my mind, at least, the whole point of this is to get a hold of the costs, to regulate the costs, we're really kind of going from a totally capitalistic kind of system of, kind of, oh, it costs me a lot more, I've got to have the money, to saying, this is the money we've got. And these are the rates, and this is how we're going to make it work. So anyway, I just think that's kind of in my head. Now, maybe other people don't see that, but that's kind of what I think we're trying to do here.
Thanks, Mary. Charlie?
I basically agree with what Mary Lou just said, but I think the other part of it is having enough providers around in Oregon. So that's going to temper a little bit of what we might want to do related to the other thing. And we'll probably have too few providers no matter what we do, just because there's going to be a shortage.
Yes.
Yeah, we have all those things to keep in mind, I think.
Yeah.
Yeah, this is Morgan. I'm just going to jump in real quick. I think I agree with Mary Lou and Charlie, right? A lot of the whole point of the UHP is for provide cost containment and predictability and efficiency with a single payer system. But I think Sarah's first point here is that we don't have a purely actuarially sort of funded, right? We're relying on taxes with fairly fixed rates that will fluctuate if the economic base changes. So even if it's like in the long run, not the case, we have to sort of at least contemplate kind of like an economic cycle, right? And to see you nodding your head there. Yeah.
I agree.
Cheryl?
Hi, I just wanted to get clear on whether the startup costs, and then the transitional costs, if that's part of our revenue, will be part of our revenue proposal. It seems this overlaps a little bit with operations committee, and I'm just trying to figure out what part of this needs to be in our revenue proposal.
Yeah, so this also as a future bullet is we have coordination here with plan design and with Milliman to sync up with how are they thinking about plan design and reserves, right? There are ways on the plan design and sort of how do you maybe capitalize some of that over time. But because it's not purely sort of a health plan, right? We've got this here, so it kind of lands a little bit in between. So all to say is I think we're aware of kind of like this sort of this question kind of splitting across the two committees, and I know it's a flag for us and with Mimi to kind of coordinate with Milliman and this one.
And I thought even with operations, I think that's worth making that
Yes,
distinction.
yes, and operations. Thank you.
Yeah. Okay, thanks.
Yeah, when I saw that on the previous slide that Mimi was introducing, because I'm relatively new to the project, I've been tracking from a distance. I thought, oh boy, where am I treading into other territory? But I think the point is, you're looking at ongoing revenues that will cover your ongoing costs at a mature program level, and there will be timing issues, and there will be one-time costs that are not necessarily going to be, or maybe they are going to be covered and then repaid by those ongoing revenues. So some of that is just, it is very much revenue centric.
That makes sense. Thanks, Sarah. This has always been a bit confusing to me.
Yeah, I should have said that up front.
Okay, thanks.
Charlie?
So I think the current preliminary proposal is pretty clear that it is only about ongoing costs and does not include the startup costs, the reserve requirements costs. So it's very much a preliminary proposal at this point, because it clearly does not include those. And I think it is clear in the document that it does. It says right out front that it does not include those. So what I'm not sure what the governance board is going to do with that at this point, but I think that from our side, we made that pretty clear. So.
Yeah, that makes sense. And I mean, it could be that there are, when all of the numbers are completed, it could be that there's a way that some of it could be repaid, like for example, with a borrowing, as you suggested, that might be worked into an ongoing operation model, but that's kind of hard to say at this point. Okay, next slide. So this is just a little bit of a reflection on my experience working with the paid family medical leave program in Washington State. So paid family medical leave was established in 2017. They began collecting premiums, I believe, in 2019. Had the bad luck of having to start making benefit payments during a pandemic. So hopefully that will not be repeated with the program you all are considering. But that wasn't the only reason that the fund ran into trouble. So on the left-hand graph, you can see the light blue line is the monthly fund balance in 2021. You can kind of see there's a downward slope even then. Contributions were not actuarially adjusted. They were set in statute at a flat level, and there was an adjustment, but it would only kick in when the account balance got to a certain point. So it was very much an accounting mechanism and not an actuarial mechanism. So you can see in 2022, contributions did not keep pace with benefit payouts. So the fund went a little bit insolvent fall of 22. And then in fiscal year 2023, it actually needed quite a large cash infusion, most of which was for benefit payments. I do believe there was a little bit that was also covering some startup costs that were not funded as well. So flip to the right and you can see the teal line with that infusion. With about 5 years of history now, they are pretty much at stable levels now, and things have improved. Charlie?
I mean, so just looking at the data, it looks like there must be some quarterly thing going on besides just a monthly thing. Is that correct?
Yeah, and this is, it's a little bit different because it's like just they're paying their wages while they're on leave. So it's there's some fluctuations there as well. But yeah, I think it's probably related, frankly, to the length of claims. I think they get like 12 weeks or something like that. So there's probably dips and spikes that might be a little bit seasonal.
Yeah.
Jeff?
Thank you. Can you elaborate on your comment where you said the rates were not actuarial set, they were set by um, statute? That to me translate is that the elected officials set the rate. Is that an accurate assessment on my part?
We're being recorded. Yes, yeah, that is, so it was, I mean, there was a lot of modeling that went into it, in the 2018, 2019, and they did, have projections. But yes, the first, I believe it was like 0.4%, and then it was supposed gonna go either down if the account balance went up too high. There was a kind of complicated accounting based method, that was tiny percentages, and the funding level kicked in the rate increase. It was not based on like, oh, well, this is our experience over the last year. We anticipate a higher volume of claims next year, or claims are actually longer than we had expected them to be. And so therefore we need to have an actuary determine what the rate should be. Now they do, but there was actually Milliman did great work in 2022 to kind of look at the funding, the history, and look at the formula and make some accommodations, and the legislature did accept those in 2022 and 2023 along with the appropriation.
Just to follow, so to confirm, it was initially set by the elected officials, but now it is transitioned to a actuarial based assessment of rates.
Yes, yeah, I think there's still in statute like some limits on the percentages, but yes, it does automatically adjust and the actuary set it.
Thank you.
Any other questions on this one? Okay. Oh, and just real quick on that one, their reserve target is 3 months of benefit payments. Charlie?
This question relates very much to what Jeff just said, but it's pretty much off topic, but I wanted to get it out there while I'm thinking about it. So my expectation is that because of Oregon Constitution and the way that tax increases have to occur in Oregon, that we cannot have actuarially based tax rates, that we have to set them in statute. But I would like to find out if that's actually true, if there's a way that we could set tax rates within a range that are actuarially based, or do we have to just go by statute? So that's I guess a legal question, a constitutional question that I think could be interesting to find out.
Yeah, that would definitely be.
If I could jump in on that a little bit, because I've got a pretty good working knowledge of the Oregon PERS retirement system. And you have that when the retirement system was set up now decades ago. But over the years, it has come to be 100% actuarial set. So the PERS board every 2 years sets what the rates will be for every government participant in the retirement program, which is virtually every the state government, county, city, schools. They set what the rate is, and it has to be paid. The political impact is still set in terms of what the wages are, which drive the PERS benefits. But the system has been, although initially set up much like this one was, it is now 100% actuarial based, and every government has to pay what the new rate is every 2 years.
So I guess my further question is, so I think that's an answer for what can happen for government entities. I'm not sure if the Oregon Constitution would allow that sort of thing to happen for private entities. But again, I think it's a question worth pursuing. So
Yeah,
I agree with Charlie. It's only apply what I've said only applies to the governments, school districts. Not sure whether I agree, it would have to be explored to see whether or not that could be also same standard could be applied on the private sector side.
So if the tax rate can't be automatically adjusted, it would put potentially more pressure on the other revenue streams like the premiums and the things that you do have flexibility with. And that could then mean there might be larger cost increases for those individuals or employers. So it's a really good and important point to answer.
Or pressure on the expense side.
Yeah. Great. Next slide, Morgan. So I think this is kind of getting into where we, definitely would need to engage with the other committees doing good work here. But if we were to kind of do this as a budget model, how I would approach it is you'd have some sort of limit. Your policy would have some sort of limit at a not to exceed of administrative costs as a not to exceed at program maturity. So I put 3 to 5% of annual expenditures in here, although I don't know what it would be in the kind of Medicaid and healthcare context. That's also a lot of money with the amount of money that we're talking about. Identify one-time costs. So your IT systems can be extremely expensive. This might be where a bond option would be a good one, bond for the IT system. And then ongoing costs, of course, would be ideally covered by the revenue sources that Morgan was covering at the beginning of the program. I underlined core infrastructure just because this is one area where I do feel like, especially with my recent experience at DCYF in Washington State, it's very important to make sure that this is really well thought out and that sufficient resources are identified for this area. It's very hard to go back and ask the legislature for more money for government. So this is an area where you want to really get it right. We'd want to include the adequate reserves in both the ongoing and the upfront cost model, and then potentially, depending on the direction of this group that makes recommendations, repayment of startup costs in the cost estimate as well. And potential strategies. So, there's a direct to state appropriation, so one-time allocation from the general fund for some year or a couple of years of core operations. I think PFML had 2 years of operations funded in that initial appropriation, one-time costs that we just talked about, and or a recommended reserve amount so that there's the funding on hand to cover the reserve target. Another option is a short-term interfund loan. And this is, where the upfront costs are repaid over a number of years with the revenues from the program. And another approach with the reserves is to model a phased-in approach over of several years. These could all be considered in context with each other, and they all have benefits. So just kind of putting them here for your future consideration, and we'll look into all of these. Charlie?
Yeah, and I've already mentioned these, but just to make sure that they're on these as part of potential strategies. Another one is the sale of bonds, and which is sort of like a short-term interfund loan, but sort of a different place to get it from. And then another option is that could do something is, and you still have to have startup costs for this, but the reinsurance is another possible thing to look into. So I think those should be on this list. And again, those would all sort of play together with the rest of the things, but they should all be used and thought of.
That's great. Thank you. Yes. And I think the sale of bonds could be a great mechanism, especially for your IT costs, because I'm assuming there will be a substantial need for an IT build out, and that's an appropriate use of bond revenue. And if there's other options or ideas that come to mind after this, please do send them our way. So on the last slide here, these are just our next steps. So again, we're going to coordinate with Milliman, and now we'll add operations committee and anyone else that staff thinks we should be speaking with. We're going to continue to look into best practices from professional and academic literature, like the Society of Actuaries, if anybody wants to have any riveting reading sent their way. And we're going to be looking at some of the national and international approaches. So while Morgan was speaking, I peeked at the presentation for the operations committee. It looks like there's some good models in other countries too. So we'll definitely add those to our list to research, as well as the questions you all asked today. Charlie?
So one other source is a member of this committee who's not here today, but talking with Chun-Wei Chi and find out how did Taiwan deal with all of these things, I think would be useful to get some inside information from a successful program in a different country.
Yeah,
that's great. Thank you.
Yeah, Sarah Chun-Wei is one of the board members, and I think part architect of that nation's single payer system.
Wow.
Yep. Mary.
Just a brief comment about dot point 3 here on the, other mostly international approaches, because I don't know that there's been really any national that's gotten off the ground. But I was back in the days of starting school-based health centers in Oregon, and we were the second one in the nation. Minneapolis was the first. And one of the things I learned by kind of approaching and looking at how did they do it, et cetera, so we could do it better or do it at least as well, found that they had done it quite a few years before we kind of got wind and decided to try to do it. And I think this might be the same there. Canada, other places did it quite a long time ago. And what I think you tend to find is people who put those things together didn't necessarily document it totally well, nor are they alive now or, can remember exactly. And so I think we naively walked into some things in Oregon, starting our school-based health centers, that didn't have to do with finances at all. Had to do with politics and anyway, so, but it was kind of downplayed when I actually went to Minnesota, talked to the people who were there and tried to get their, best stuff. And so all of a sudden, when I came back and said, oh, this is not too hard, this is blah, 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 it didn't turn out to exactly be that way because, and I'm just afraid that some of these other national systems, have been going for a long time, and it may be difficult to even have people, be able to find out exactly how they did it on these kinds of issues in the beginning. But it's just a word of caution that it sounded a lot easier than it turned out to be for us. So don't want to rain on the parade. But anyway, that just came to mind. That's all.
That's helpful. I think it is hard to find documentation sometimes of decision making when it's kind of at the sausage making stage. I looked at some of the other, similar to this group in other states, and, you open their reports and you control F for $, and there's no $sign in there. I'm like, nobody's taught at the point where they want to put any numbers down on paper. So it just makes it really hard to do this research.
Yeah.
So thanks for that.
Yeah.
Great. Well, that brings us to the end of this part of the agenda. Cheryl, I'm thinking probably we got plenty of time here to kind of kick off and orient around the proposal, and then we'll have some slides to kind of cover the main parts of the proposal and the draft memo, and use that as a platform for any discussion amendments to the plan. To the proposal.
Yeah, that sounds good, Morgan. And I would just ask you to hold the break when it makes sense. In between because we're a little bit behind. So I'll just count on you to say when it's a good time for a break.
Great. Mimi, do you want to do anything here before we do the discussion about the structure of the proposal and the memo, or should we just dive right in?
Yeah, I'll just make a brief comment just to kind of clarify our approach is that you will notice that there is a proposal from the Universal Health Plan Governance Board that has the logo, Core Revenue Preliminary Proposal. And this is really the straw proposal format that the board has requested that proposals come in. So it is basically sort of a little bit of a Cliff Notes with some additions, some more of the historical perspective and very specific to the governance board and their deliverables. So there is that. The content of the proposal, however, is completely contained in addition within the Echo Northwest proposal. So that's really what they're going to be discussing. We will, when you all come to a vote and decide, both of those documents will go together with the Universal Health Plan Governance Board portion, citing and including as an attachment the Echo Northwest part. So I know it's a little bit confusing, but we wanted to make sure to present to the board in the format that they have requested and also have all of the incredible detail that has been provided by Echo Northwest. So I'm just going to stop for a moment, see if anyone has questions about that. Super. Okay, take it away. Thank you, Morgan.
I want to turn over to Will And sorry, I turned my camera off for a second. Now I can't turn it back on. So for you, it's probably user on my part. But Will, go ahead and take it away.
I don't think I'm sharing the correct screen, am I? Let's see. Stop sharing. Try again. Let's see. Okay, that should work.
We had a terrific picture of your face.
Is that right? Oh, I'm flattered, Jeff.
Mhm.
Is that, can we see the
Yeah.
slides? Oh, boy.
Yeah, now it's good. We can still see your slides, though. It's not in presenter mode, kind of the
Oh,
upcoming slides, just so you
oh.
know.
Thank you very
So
much.
that makes it a little small.
Yeah, let me view, right? And then usually there's presenter view, but I think reading views suffice, right?
That's fine.
Okay. All right.
That's perfect.
Yeah, so I've drawn the straw, no pun intended, to well, that was intentional, to discuss the broad contours of the memo, which I'd like to thank Linda Krieger, excuse me, I mispronounced your last name, for pointing out the typos in an earlier version, which have since been corrected. So in broad strokes, as we all know, the proposal is meant to provide a basis for a coherent, equitable, and sustainable revenue plan to finance the UHP. The plan is meant to cover, as Charlie pointed out, is meant to cover exclusively the ongoing annual component and is not meant to cover transition costs or reserve capitalization. I should add, probably, certainly most members of the committee, but most people have been following along closely. The notion here is that due to the availability of high quality tax data, the objective was to come up with a plan that would finance the projected cost of a universal healthcare program in 2022. And so that was based on the best available data. And that is sort of narrowly what the project here was, the project that's being described in the memo. So it's we've sort of broken out the problem in such a way that the next step will be to forecast costs and hopefully develop a similar system that presumably develop a similar system that will be able to cover ongoing costs in the future. So the overarching theme and the claim is that the system of taxes that's being proposed here is not meant to develop new revenue, to place new burdens on the Oregon economy, but to repurpose status quo contributions, healthcare contributions from employees and individual healthcares. In order to arrive at a proposal, it's necessary to know how much money one needs. And in order to do that, there's a number of assumptions that need to be made, some of which have been alluded to so far. The memo points out a couple of them, which I'll go over. In some sense, well, I guess monetarily, it's not even the largest anymore, but the committee has decided, taking into consideration a tremendous amount of information about administrative cost savings. Committee member John Santa, in particular, was, I think, a big advocate for this. Was unable to make it today. Based on the best available data, the committee has decided to assume larger, roughly double cost savings, administrative cost savings relative to the Joint Task Force. And the effect of which was to lower the funding target by approximately $1.3 billion in 2022 terms. Lots of assumptions, of course, around federal funds, a very uncertain environment. As Jeff pointed out, it's not achieving full CMS waivers would not exactly be the death knell, but it would require other considerations, Medicare Advantage status, for instance. But the assumption underlying the memo as it's written is that the system would be able to achieve, would get waivers for the current Medicare and Medicaid federal payments. But there is a good deal of uncertainty precipitated by HR 1 the recent budget reforms. And the variance could cause, according to the CBO, I believe is the appropriate site here, as much as a $3 billion variance in the cost estimate of providing a UHP PEB plus benefit plan. There is also implicit in the memo an assumption that is somewhat like the optimist assumption in the Joint Task Force memo, that there would be patient price parity. So all providers would receive same payments regardless of whether or not the seeker of healthcare services was Medicaid eligible. The effect of raising the payments that would receive for seeing Medicaid patients would be to increase the Medicaid match from the federal government. The presumption is that would be above board and acceptable to the federal government. There are other assumptions. Of course, we mentioned this critical assumption about revenue streams keeping pace with healthcare cost growth. I think Richard's probably perhaps the leading expert in the room on this. But one main objective, one reason for the feasibility of imagining a universal healthcare program is for cost containment and to realize cost efficiencies. But I think it's still worth pointing out that at least conceptually, one could contain its administrative costs on an annual basis, and if they're still growing at a rate that exceeds the revenue growth, you would still ultimately have a problem. There would still be a wedge between the cash coming in and the cash going out. So the sort of implicit assumption that the board will presumably have to address is that this is a somewhat of a snapshot program that would theoretically work for 2022, but it is an assumption that the revenue mechanisms identified in the proposal will in fact be able to keep pace with the tremendous growth in health costs. And then there's also a rather technical assumption, and that's simply the amount of available money in the system that's appropriable for a universal healthcare plan is predicated on the national health expenditures accounts. And there's some ambiguity in those about whether or not there's double counting in a particular line item related to equipment and structures. That has not been resolved. And it could theoretically lead to another swing in our funding estimate of as much as $1.5 billion. So that's all the sort of legalese, the fine print about what has gone into the assumption. So I also a sort of late breaking request by our chair, Cheryl. And I'm perhaps as guilty as anyone for advancing this particular terminology of a funding gap, and that's sort of a function of the way I was working through the Optimist math when I first saw it. So in the current draft, there's multiple references to a funding gap. So for instance, it says the presumed 2022 funding gap is $16.9 billion. The existence of the funding gap this proposal covers is mostly due to the loss of employer-paid premiums for private health insurance under the UHP. So the notion of the funding gap essentially is that once we move over all the transferable sources that are in the current system, federal sources, for instance, there will be and we do away with a multi-payer system and employer-sponsored insurance payments. There will be a gap. Now, this notion of a gap is sort of it doesn't take into account that there are a lot of payments that would are currently made in the status quo that would no longer be made in a prospective UHP. Out-of-pocket expenses, private contributions to employer-sponsored health insurance plans. And so there's, I think, a very useful suggestion to think about how we can restructure the language around this, right? So funding gap often means the money isn't available, right, in a lot of contexts. In this context, what it means is that once you transfer over sort of hard money from the federal government and the like, there's still, a need to rechannel private and employer-sponsored contributions to the healthcare system into revenue for the UHP. And so funding gap isn't a particularly political, isn't a particularly savvy way of talking about this. So I'd like to throw it out to the group in case anybody has any brilliant suggestions. I'm certainly going to think about it. And my understanding is we'll get a couple sentences around this before it goes to the board. Yeah, Cheryl.
Thank you for addressing this concern, Will. I just feel like a proposal's dead in the water if we call it a funding gap. I mean, because again, that means to me that there isn't funding there. I think Mimi had a couple of good suggestions and I'm not recalling them right now. I don't know, Mimi, if you can remember them off the top of your head. I thought that
I
was
think we were talking about reallocating revenue. So a funding reallocation, I think kind of was what we were talking about, sort of describing really that the money is already there.
Charlie?
So I think reallocating might be a good one. Another possibility would be redirecting, and essentially it's redirecting money. And so I also want to point out that about 60% of this money that we're talking about is from the loss of employer paid premiums, and about 40% actually is redirecting money that currently comes from individuals, whether it's out of pocket or premium. So my suggestion would be something like redirected current funding or something like that.
Can I talk to you offline about getting those specific statistics? It seems worth perhaps putting in there.
What was that again?
I wonder if it's sensible to put that the statistics that you just quoted, 40% comes from individuals and the balance from.
To me, it might be worthwhile putting in, but
I would think so too.
Yeah.
I'll follow up with you, Charlie.
great. Thanks.
Thank you. I think that's good. That is yeah. It's a great
And I don't know if you could see Jeff has his hand up
Jeff,
as well.
excuse me.
Well,
Yeah.
sorry.
Mm-hmm.
I think funding gap is an accurate description.
It is. It's just not. It's not a very strategic one. Right?
It may not be an elegant phrase, but it has the merits of being straightforward. There is money. Some people pay more, some people pay less. Some businesses pay more, some people pay less. Depending where you're sitting on that, it's either a redirection benefit or it's a gap. I think we are better. We've been very effective playing it straight with our language and our discussions and back and forth. Changing the language from funding gap, I think obfuscates the issue, and we should just be straightforward about it. It enhances our credibility by doing so.
Duly noted, Jeff.
But I suspect I'll be outvoted on this one.
I don't know. Contemplating.
We'll circle back to that. Food for thought. So as you all know, there's a variety of funding mechanisms. But broadly speaking, as the memo sort of states, it's useful to divide them into taxes that fall nominally, at least, setting aside the actual incidence on businesses and taxes that fall nominally on individuals. And of course, in the latter category, the largest are per person premiums and the healthcare personal income tax. I have heard at least one. I don't know if he still feels the same way, but I know Richard has expressed some perhaps displeasure with a graph of this nature. I don't know if you'd prefer a bar chart or a pie chart or something, but at least in the current draft, this shows if you take a rectangle of this size, it represents $16.9 billion in, excuse my term, a funding gap, or the net money that needs to be redirected. Approximately half of that would come from I should point out another important feature of this graph is that the personal income tax component is net of the credit that one would be able to apply on a personal income tax return for employee payroll taxes paid on that employee's behalf, right? So this is really the composition of the net proceeds that are going to a prospective universal health care plan. So again, as Morgan pointed out, there are relatively small contributions from incremental increases to the corporate income tax and the corporate activity tax. Again, per Linda's comment, these have been corrected in the document, in the table, and in the text. Likewise, I think John Santa in particular was a very big advocate for thinking this through carefully. The personal premiums are net of credits that are given for payments, Part B Medicare payments, premium payments, right? So this is truly net income that's going to the UHP. So this is what the overall picture looks like. Happy to take suggestions, criticisms about the presentation. If you prefer a bar chart or something else, you can certainly send me an email. I would like to. Okay, so yeah, this is again, this should be well known, but my task here is to review the contents of the memo. The employer payroll tax, as Charlie mentioned, landed on 11% on wages above a $200,000 firm threshold, and that $200,000 firm-wide threshold discounts. So there's an individual liability that excludes from the employer's EPT liability income paid to individuals who earn less than the federal poverty level. And the idea is that this replaces the employee sponsored contributions. And again, there's the credit that I mentioned that offsets liabilities, healthcare, Oregon healthcare liabilities on the state income tax return of the person, the individual on whom those EPT is paid on behalf of. I feel like there was another salient point here to make with respect to that. Charlie made the good point that clarified Linda's question about the memo. The corporate income tax, there's again, not a huge source of revenue in the plan, but it represents a 3 percentage point increase in the corporate income tax. And the corporate activity tax, sort of a gross receipts tax, is a 0.1 percentage increase. I believe it's currently 0.57% of gross revenue in the state of Oregon after you exclude various labor costs. Again, as Charlie pointed out, we landed on a 9% flat rate on the healthcare personal income tax. So it's a 9 percentage point increase relative to the Oregon personal income tax that goes to the general fund. So there's a 9% flat rate above 200% of the federal poverty level, and there is a soft cap at a $30,000 total premiums plus HCPIT healthcare tax bill. At that point, the marginal rate decreases. So this is an aspect of the plan that reduces the progressivity. The marginal rate falls to 3%. Yes, Charlie?
So the way the calculator currently works, so the revenue is figured out on the soft cap is not based on both the HCPIT and the personal premium. It's solely on the HCPIT. So the personal premium is in addition to that. And now it could be changed, but I would actually argue against changing it, at least very much in that direction. And it would take quite a bit to change it, but it is solely on the HCPIT.
Thank you. I misunderstood that. Thank you. No, and my error shouldn't change your proposal. No, thank you very much for clarifying
Yeah, and
that.
so it's not written in this, so it's just when you're talking about it
Yes.
that we need to say it. But you might want to write something about that. And I will also say this for the EPT up above, that it is a non-refundable credit, or it
Thank
is
you.
perhaps that it's a credit only against it's a non-refundable credit only against the HCPIT for the EPT. So I think that's important to point out as well.
Yep. I'll go back and check the memo too. I don't know if you've done that, but those are points that need to be in there, I would think. I'll check that.
Yeah.
EPT is non-refundable and a credit only against the healthcare tax. Mary Lou?
I guess I'm just thinking that that first dot point, it would be confusing if you didn't have all this discussion going on.
Yeah.
With soft cap at 30,000, it would confuse me as a person on the personal income tax with, you know, if I make more than 30,000, I mean, it doesn't clearly say what I think you're trying to say.
I didn't make this slide, Mary, but I
Okay.
feel the same way.
Whoever made
It
it,
is
but
confusing. That's why I was careful to say it that way. Yes, yes.
It just doesn't, you know.
I totally
people
agree.
would go like, what?
Your point
What's that
is
mean?
well taken. Your point is very well taken. Yes.
Thank you.
Yeah. So just to be clear, it's like, you know, once you, you know, again, keeping in mind what Charlie just said. So once you reach $30,000 in strictly HCPIT liability,
Yes.
at that point, your marginal rate
goes down to 3.
Yeah.
Yes. Yeah.
And that's, I mean, that's obviously a lot more money than $30,000 in AGI or something.
Yeah. Or something. Yeah. It just, yeah.
Great. So with respect to the per person premium, yes, Charlie.
So the other thing I want to point out is that I'm going to continue looking at some variations in this, and so one of the variations that I think we should continue looking at, and I'll briefly say why. So right now the choice is 200% of federal poverty level. That there's essentially you pay no taxes, no HCPIT on income that's less than that, and that's in part because of the Oregon Bridge program. Now that may be going away with HR1. So we have no idea what the response is going to be. And we'll know more probably by February. There's going to be some preliminary numbers coming out of what's the effect of the HR1 on Oregon Medicaid. But the more data will probably be available by February. And so that may end up being that the bridge program goes away, which means that current Oregonians who are in that program from 138% to 200% of federal poverty level that are Medicaid eligible would not no longer be. And so it's unclear. It's not clear to me that we should necessarily continue that exemption up to 200% of federal poverty level, that we should also look at 138% of federal poverty level. Or something else in there. So I think we want to keep that in mind, that as all of these parameters are, it's a work in progress, and we need to look at perceived fairness with different possibilities.
So the proposal I hear you saying is, so if you were to, so the bridge program goes away, folks between 138 and 200% of the federal poverty level will no longer be eligible for Medicaid. And then, you know, if you knock this down to 138%, you'd start charging people right after 138%, right? So it would. Yeah,
they would have a small tax liability based upon how much income they have above that. So
yeah.
And for most people, it would be offset, depending upon what we do with the EPT credit, it would be offset by the EPT. So they wouldn't actually pay anything. Those who have that income not from wages, so if they had that amount of income, but it wasn't from wages, they would actually pay something. But if it's from wages, they wouldn't pay anything anyway. So
interesting.
Trying to explain this.
Yeah, it's hard. Me?
Yeah, I just wanted to ask a clarifying question, Charlie. Would it be correct to state then that the um, employer payroll tax credit will be available only to offset payment of the healthcare personal income tax?
Yes.
Is that correct? Okay, thank
Yes.
you.
Yeah, I want to make sure that that's very clear in the memo too. I'm not sure if that's sufficiently sharp. Yeah, Richard?
Yeah, I wanted to reassure Mary Lou that it's my personal mission to create scenarios, especially after the comments by Alex and Linda at the start of our meeting, to go back and look at thoroughly at each type of income, where they derive their income from at each major income level, and create a scenario that shows what it is now with personal with individual paid premiums as well as employer paid premiums, if there are any, individual out of pocket for cost sharing, and uninsured people paying whatever they pay, and then create scenarios so that we can present that to Mary Lou so she won't shake her head. I think we can do it, but it's hard to do this globally, but I think with individual scenarios, I think it's critical to selling it to small businesses and to citizenry in general. So it's my mission to create those scenarios, along with, of course, with Charlie and Echo to do that. But we can make it really clear if we, I think, go scenario by scenario. Thank you.
Thank you, Richard.
Yeah, Charlie.
So I just want to mention that along with that, I have created a spreadsheet that has scenarios. Right now, it's just got 18 different scenarios, but I will expand that, and I will actually refine it to some clearer choices of tax structures. So it's about 18 different scenarios with, I think, 7 different tax structures. And I can create multiple of those without a whole lot of difficulty. But if people wanted to look at that, especially if committee members wanted to look at that and suggest other scenarios that they would like to have more clearly portrayed. And I have some ideas on, I think I haven't quite clearly portrayed it enough yet. So I will work on that with Richard and others.
I want to make it clear that, Charlie is responsible. I mean, Charlie's been gracious about doing all the spreadsheet work. What I talked about, my personal mission, is to create a slide deck or slides for the text that goes out that describes what's in Charlie's scenarios. That's what I meant. Thank you.
Okay, thank you. Thank you.
Regarding the per person premium, again, this has the phase-in structure. I'm always inclined to think in terms of the EITC, but I'm sort of negative. It phases in beginning at 350% of the federal poverty level, and it reaches a maximum of 4,000 per adult and 2,000 for dependent. And this, is meant to replace. I mean, Charlie, I put this quite vividly, I thought, earlier, where you have a system whereby it doesn't matter how much in the company, whether it's the CEO or someone who earns considerably less. The payments that are required of this person generally in an ESI are insensitive to the income level, and so this is a mechanism that's meant to introduce that sort of sensitivity. So as you recall from the Charlie, please go ahead.
Yeah, so I think we also need to point out that this is where the Part B premium credit comes into play.
Yep.
That the Part B premium credit, at this point, we're thinking about it just against the
PPP,
the new state personal premium that's proposed. So that's where that credit would be, and then we have to look at that a little bit more to see if that seems fair, based upon the numbers, largely exploring what the effect of the non-taxability of Social Security is, and see if we need to do a little bit more with the Part B premiums, or if that should be sufficient. And so that's still an ongoing
Okay.
look, I guess I would say. But
Yeah.
right now, it's the Part B premiums that are paid can be taken as a credit against the per person premium.
Right.
Mhm.
Again, non-refundable.
Yep, non-refundable. Thank you, Charlie. You may recall that there was a small quadrant in I believe, the lower right corner of our rectangle that represented the $16.9 billion redirecting requisite revenue to be redirected. And that consisted of a somewhat TBD collection of taxes, one of which is the lodging tax. I think that Charlie has largely been a proponent of, that is, sort of cleverly covers the cost of out-of-state visitors whose insurance won't otherwise cover them. Another sort of class of these supplemental revenue sources involves sumptuary taxes on sin taxes on cigarettes, alcohol, marijuana to advance various public health policies. The the notion is, of course, to internalize the cost that such sort of risky behaviors put on a healthcare system, and to generally, I think, probably disincentivize behaviors that are unhealthy. There is my colleague Andrew is concerned that perhaps, and I know that there's been uh, advice from Mimi to stick to the fundamentals and not necessarily play the political angles, but there is at least some concern that this might instigate a political fight on certain vested interests. And the observation is that it is a fairly small revenue stream. So that may be one thing that the board wishes to consider. Jeff, I think I saw your hand first.
I'll defer to Mary.
Oh, I guess I'm just going to lose all my public health credentials here, and say I'm down at the bolded thing. The political fight, is it worth it for such a small amount of revenue? And I think we had some public input back a ways that also comes up, not just the lobbying and all the rest of it, but people really feeling that we're somehow targeting their behavior and their, it just really can get, I've been there and fought so hard for like the current pretty high cigarette taxes, tobacco
Yeah.
taxes we have in Oregon, and was well worth doing that. But for this, I'm just not sure that that I think it's worth it.
Yep. Jeff, did you want to?
Yeah, my comment is going back to reinforce the argument I was making earlier that the word gap is accurate because we're raising taxes on all these areas. And if you don't have a gap, why are you raising taxes in these areas?
Bethany, I'm not sure if ORS allows you to speak at this point, or.
No, Bethany's on the committee.
Oh, I'm sorry.
Yeah,
I'm so sorry.
I don't speak up very often, but
Oh,
I
I'm
just
so very
wanted
sorry.
to say, along with Mary, I'm a medical provider, and while I don't want to lose my license over this, I know talking to patients about these things and how difficult it is in a one-to-one conversation, I'm not sure it's worth the small revenue. That's all I'm gonna say.
Thanks, Bethany.
Moving on. This is largely redundant with the information that Morgan shared, but in the interest of due diligence and explaining the contents of the memo, you can see that through a combination of transfers from the federal government, from the realization of administrative cost efficiencies, the proposed plan is capable of ensuring an additional 6% of Oregonians to get us up to universality. and bringing the system up to PEB plus benefit levels. So it includes dental benefits and mental health benefits at a net reduction in the overall cost. So it is calibrated quite strategically in such a way that all the important players, all the important sectors would realize in aggregate on net cost savings in their healthcare contributions. This just represents that in a different way. As a group, individuals would realize the largest cost savings under the plan as a group, of course. The observations are that, in this, Charlie obviously sent his, Charlie sent his scenarios. It was a bit much to absorb to put in the memo, unfortunately, given the timelines, but I made suggestions that seemed true to me, and no one has objected. Charlie's read through it, and he didn't object, so it's probably correct. It's a good sign. You can certainly make statements of the following kind. If you have a non-contributing firm, a firm that does not offer an ESI, in a sort of perhaps free riding on public benefits, or simply is exposing its workforce to lack of health insurance, they will certainly have to contribute more, or they will presumably have to contribute more under the proposal. Generous employee-sponsored health insurance providers may actually see cost reductions, right? So they would benefit from the net reduction in aggregate costs. Small firms, again, Alex brought this up in the sort of preamble comments. Small firms are generally going to be exempt from via these, the $200,000 thresholds. Although, again, I think his point is well made that we need to look more carefully into how that will affect particular small businesses, so that it's not a monstrous increase in their EPT. It's also the case, I think, you don't need any fancy calculator to say that, if you have a high income households who will certainly have a liability under the proposal, who are currently uninsured or not paying for insurance premiums, and are also not paying out of pocket, they're not receiving any health care. They're paying zero for healthcare right now. Under the plan, they certainly would be paying more. So, one can, make very broad statements about that, even in the absence of specific calculators. And so those are, that's the extent of the distributional impacts that are in the current memo. But as Morgan mentioned, and as I think we discussed elsewhere, there's more ongoing work that will further clarify precisely what these distributional impacts are. I think that might be the last slide. Oh, no, I put this just for good measure. While Linda was talking, in case I messed anything up in the slides, and I don't think that I did. So I faithfully reproduced in the slides what is now in the final version of the draft memo that unfortunately Linda has not yet had the opportunity to see yet. Are there any questions? Sharon?
I just want to reiterate a very early point Jeff made, and that is to have some sort of I would call it a side-by-side, maybe that's not exactly what he said, right at the front, right, like that one pager right there by maybe the executive summary or something like that, just to put it right out there.
I heard Jeff characterizing it as a before and after. Maybe Jeff wants to go back on it and comment on.
In and out. I think I wrote it down.
Yeah, what do you?
My characterization was not a before and after. It was, what's the money coming in, various sources, and what's the money going out, various categories.
And I think what I was looking at is more of this is the current way we pay for healthcare. This is our proposal, just to show that we're actually under the current budget at this point. So,
Yeah. Charlie?
I kind of think it would be useful to have both of those things.
Yeah, I do too. Yeah, I don't think it's either.
I'm not, I think maybe it might take one page for each of those. I'm not sure you can get
Oh,
all
I
on
see.
one
Yeah,
page
yeah.
if you have both
Sure.
of them. So to me, I think the in and out part that Jeff is talking about would include the federal money that we're assuming will continue to come, and the state money that is currently there that will remain. So I think that it's not just the new stuff that's changing. It includes all of that other money that is currently being spent that we'd say we're essentially assuming that we can continue to get that in some way.
Maybe Jeff, I'm picturing, there's these well-known graphs, I think in budgets, right, where in and out is revenue and expenditures, right? Okay. It seems to me the revenue part will be more obvious how to construct than the out part. I'm not exactly sure what you mean. I mean, are you imagining mental health benefits and dental benefits?
Here's what and I know I'll be corrected if I'm in my thinking here. What I'm thinking I agree with you on the revenue side. It's fairly straightforward to identify all the pieces. Plus, there, as you have been talked about, some of the offsets. On the expense side, we are using as a model PEB plus for the kind of coverage. That is, on average, a greater level of coverage statewide than what we are currently providing. So those are, and we know we do have the data, whether it's Optimus or various other organizations, as to what on average we are currently paying per person in Oregon. So we apply a delta to that, because whenever you enhance benefit coverage, you get increased costs. So we can then come up with a number of what the total expenditures will be under the new plan. And I think that, coupled with what Cheryl has described, a before and after, provides then in 2 pages a very straightforward summary of what we need to look at. And to that end, elsewhere in the report, I think we should list the assumption that the PEB Plus program is enhanced over what we are currently have statewide.
Here's Charlie.
So I'm still not quite understanding, what Jeff is saying, but to me, it might be something like what Optimus put in their report, where they listed various, not so much is it spent on, is this money being spent on behavioral health or
Dental.
hospital or something, but instead, this money is being spent on behalf of those who are Medicare eligible. This money is being spent on behalf of those who are Medicaid eligible. Optimus has that in there, and that's essentially the numbers that I have been using for our costs. So, I think that might be one way to approach it, and basically using the Optimus numbers but scaling them back to 2022.
Yeah, exactly. I mean, that's the classic table, right? Where it shows, that's how we got to the funding gap and such, right? It shows them, Yeah,
I mean, that shows the expenditures. It doesn't show the savings on that one, but their savings are somewhere else in there. But yes, I think that might do it. We'll have to play it a little bit and see if that comes up to what, if we can get to what Cheryl and Jeff are wanting.
I think that, from my perspective, I think that does. I mean, I'm not suggesting in any way, shape, or form that we say on the expense side, well, here's how much we project is going to be spent for orthopedic procedures. How much is going to be spent? We are looking at a system in total, and we should be able to provide the revenues in total with offsets and the expenses in total and offsets, and how we got to each of those numbers.
I think we can do something.
Okay.
Anything else? Is that break time, Morgan? Are we?
I think so.
Might be a good time.
Water.
Please.
Right.
Please.
I'll defer to the chair, but
Okay, yeah, let's
perhaps we
take a
take a
break.
break and then we'll come back and vote.
Yeah,
Cheryl?
let's get back together at 11, okay?
Okay.
All right, thank you. Hi all, are we all back? You back, put on your camera so we can see. So I don't know, Morgan and Will, do you have more to present or discuss?
Will, I think that's it. I think we've covered the components of the memo in detail here. And so unless there are other questions or discussion, I think we're done.
Okay, are there any additional questions? Other things that you'd like to bring up from the committee?
Can you hear me?
Yes.
Okay, I've lost my picture. I don't know, I did something else in the break and now I'm having trouble getting back, but
Okay.
this is Mary Lou. I don't know if this is the appropriate time to say it or when it is or not, or if I'm totally off base, but I'm very nervous about taking this to the board next time. I just think it is, if I'm, I came into this late, I wasn't here for the full year, but I've probably been more immersed in it than most people who on the board, especially, and then the public. I just don't know that I think it's ready for prime time at this point, and that's just my general worry here.
Thanks, Mary Lou. Just to address the concern, I think it is a little scary, but this is a preliminary proposal. It's essentially to elicit feedback from the board. We don't assume this is final, so it's really what it is a straw proposal, very much in draft form. It's our best effort so far. That's how I would respond. But also understanding that it's a big step. I get it. Richard?
Mary Lou, what could we add or edit or remove or change about the proposal so you feel more comfortable? I mean, I have my own reservations, but what could we do to make it better so that you might feel more comfortable on a big step?
I wish I had an answer for you, Richard, on it. It's just one of those kind of general feeling about sometimes it's better to go slow to go fast. And sometimes when you go fast, you end up, raising a lot of concerns and issues, although they're laid out. I mean, anybody who really wants to be down in the weeds in this stuff, can watch all these, meetings and respond, et cetera. And, unfortunately or fortunately, the most people are totally unaware that this whole thing is even going on. So I don't know. I'm just it's really out there. So maybe this is just my angst. I'll go along with the group.
One thing that we could do that would help understand, I'm not saying this would address your concerns, but we could have text descriptions of some key scenarios that Charlie's already done the numbers behind. And that would help to say, oh, what's it like for this person who's a Nike executive? What's it like for this person who's working in a machine shop? I think we could have that within the next several weeks. Would that help, do you think, Mary Lou?
I think it would help. I just think what we're proposing in some ways is very complicated. In some ways it's not very complicated. There's, and just maybe it's how we're explaining it. But like, especially like, is it like, are we putting forth in the straw proposal, the sin taxes, the sumptuary taxes or whatever? I mean, are we proposing that as part of the straw proposal or not? Or, I'm just kind of trying to figure out exactly, I mean, I read through very carefully the long Google document from Echo Northwest last night and had a lot of like just, even questions or wording or that kind of thing. I'm just not quite sure how this whole thing and what exactly, and maybe this is because I'm still new to the board, what this straw proposal, how much of a life of its own does it take on, and kind of like, well, this is how we're moving forward. Mimi's got her hand up, so I don't know, Mimi.
Yeah, go ahead, Mimi, and then we'll call on Jeff.
Oh, okay, thank you. To your point, Mary Lou, for sure, about sort of how much does this have a life of its own? Again, as I believe Cheryl stated, it is a proposal. It is something that will go to the board. The board will say, and really the board is going to look at it from a broad perspective. For example, are these the variables that we want to be using? Do we want to consider the employer payroll tax credit, or maybe we don't? So I think there's going to be that broad look, and then it will come back, or we love this proposal and we would also like to see these three other things. We'd like to see a proposal without the tax credit. We'd like to see a proposal with sales tax, whatever it is. But so
Okay.
I will just say that it is important to get these key issues or thoughts in front of the board so they can respond. And the longer that we delay that, the further out the entire board has the opportunity to respond to this. So that would be my caveat. And certainly the work that has gone into it, some of the descriptions will go into the final report, absolutely, but not until the final decisions are made will that go into a final report. So just to kind of, I hope that clarifies a little bit.
Jeff?
I agree with Mary Lou. I think we have 1/3 of a draft report, and a very good draft on the
Mimi,
1/3 item of the
I'm on a Zoom.
inflows and outflows. We have not applied the same level of work on the transition costs, although we've
Okay.
done some, and we have not applied the same level of work on the reserves, although we have done some. So I think it's premature. That's reason number one. Reason number two, I also agree with Mary Lou's comments. Once this draft, which is the first time a draft of any kind of substance is going to the board, it will assume a life of its own. And I think we better serve the entire process by having a more fully built out draft report, to which I referred to in my point number one. And then lastly is, having watched some of the governance board's discussions and previous conversations about the finance and revenue, reinforces the point. This draft report, if it goes as presented, will have a life of its own. I think the odds are small that they collectively will look at it and say, oh, take this in, put this in, take this out. I think their most likely response is a sigh of relief that they have something, and leave it at that. So it's a good draft report with 1/3, but let's hold on until we get the rest of it filled out.
I'm not sure where we go from here. Does anyone have any comments? I mean, whether it's Echo Northwest, or I would look to Charlie and Richard about what else we could do. I'm just going to say I'm in favor of putting this draft proposal forward. Again, to elicit comments from the board. I don't actually agree that the board will just be, okay, it's great, we're fine with it. I think they will have comments and feedback. I also think, one of my questions was, well, are we going to include the consumption taxes or not? And that would be something maybe we'd either need to just say we were thinking of including it, but we're not sure. And that would be one really concrete thing that the board could respond to. So I feel like we've been doing this for a year now, and I think we need to put something forward to the board. I'm not sure I understand the comment of having a life of its own. It has no power to go forward without the board. I mean, we can't just make it so. The board has to weigh in. There are other committees doing work. They're all waiting for us to have some sort of a draft proposal. So I'm concerned about holding back for a longer amount of time, like a month or 2 months or however long. So,
And
Amy.
Cheryl, I have a suggestion, if I may, because I don't know how many people have had the opportunity to look at sort of the high level summary that is going to go before the board. Oh, and I will definitely let you speak after me. Apologies, Bethany. So what I'm wondering is, even it literally is about 2 pages. And I'm wondering if because we have a little bit of time, take the opportunity to kind of go over that. Maybe will take 5 minutes, and I think people will then have a better sense, at least, of what is going in front of the board. And again, with all of the literature and the backing and all of the work from Echo Northwest behind it. But so that's my thought, that we could go over that. That might be helpful. I can pull it up on my
So you're saying to go over that now?
Yeah, that was my thought, but I want to,
Okay,
Bethany.
that sounds good to me, and let's go to Bethany.
Yeah, thank you.
Well, I actually lowered my hand back down, but I was just gonna say along your lines, Cheryl, I agree with you because while I haven't been as outspoken, I have been at all the meetings, and there is so much here, so much work has gone into it, but we can't go much further without the board's input, and just agree with that. Like, knowing that this is just a draft, we're putting it my understanding is we're giving it to them to get feedback so we can keep working on it. So
that's how I see it. Yeah.
the longer we wait, we're just dragging it out.
Exactly. Thank you. Okay, go ahead, Amy.
Yeah, thank you. So again, this is the in the format that the board has requested that straw proposals be presented. So this is very simplistic, a high level summary, talking about all of the work that you all have done to talk about the principles and the values and what has gone into this. So it's the core revenue package. There is a credit, healthcare income tax offset by the personal income tax credit, a progressive personal premium. Here it says consideration of additional taxes. So you're absolutely right, Mary Lou. It doesn't actually say yes or no, but it does have a consideration. And then I think, Jeff, to your point, absolutely, this is not the final report from the Finance and Revenue Committee. However, it's a portion of it. And again, to get that feedback this is the mechanism that we have to get feedback from the board. So I am the person who is sort of the timekeeper of what we are doing. And the September 2026 deadline is coming faster and faster. And I think it's important for the board to have the opportunity to dive into the thoughts that you have and all the work that's been done by this committee. So Richard, I see you have your hand up, please.
Roll it. Would you please roll it back up?
You betcha.
Number 3 is a healthcare income tax offset by the personal income tax credit. I think you mean the employer payroll tax credit. Yeah.
Mhm.
Great.
Thank you.
Thank you. Not take the income out.
For payroll. Whoops. Thank you. There we go.
Thank you. And tax. Sorry.
Income credit. No, we got to get this right.
Yeah.
Apologies for doing this in real time. But
great. Thank you.
No, thank you. All right. I'm going to scroll down. So again, other people, please chime in. This is a great time. This has some of the questions that they have. What was the focus of this recommendation? So this kind of goes back to some of the board work. I don't know how germane it will be to you all, but it does talk about what is requested of the Finance and Revenue Committee. Talks about alignment with the structure of the board, how it aligns with the overarching principles from the Universal Health Plan Governance Board. And then again, sort of to your point, Jeff, this is a component of the financing Universal Health Plan deliverable. Oops, that doesn't sound right.
Just an extra the in front of the,
Yeah.
I think.
Oh.
Not that you
Thank
need
you.
to, yeah, okay. We don't need to wordsmith and
Yeah.
write, as you said.
We'll fix it. Yep, I promise we'll fix typos, but I just wanted alignment with the joint task force. There's a little bit of a divergence from the joint task force recommendations. And then this goes on a lot further. But I wanted just to review this. We'll can email out to all of the committee members this most updated version, which kind of has the word reallocate revenue instead of create revenue for a universal health plan. So I'm going to stop sharing now. And of course, people, I think this is the point when Chair Ramirez will ask if people want to make a motion. So I will leave it at that unless there's other questions.
I do want to just check in. I think this is mostly with Will and Morgan. It seems that there was just some tweaking to do on the proposal. So if we vote on the proposal today to move it forward, then you would still be doing some very small I don't know, corrections for
Editing.
us or clarifications. And I don't know about the display of the one pagers, if that will be included in this draft proposal or not. I just wanted to clarify that, you know, what we were talking about in terms of showing the current way that we pay for healthcare versus this proposal.
Yeah, I think that's going to take a little time to build that up. I mean,
Okay, I just
several,
want to
yeah.
clarify. Yeah, okay.
But
So,
to your point, Cheryl, that there are some notes here that would be very easy to implement.
okay,
So maybe
okay.
still valid. Yeah.
So just to go over the timeline, if we vote in favor of submitting this proposal to the board, Mimi, could you just remind us? So if we were to tweak it, Will is tweaking the proposal a little bit in the next day or two, then it would go to the board maybe later this week.
Yes, absolutely.
Okay.
They go out to the board no later than Friday of this week. So that will give them essentially almost a whole week to
Mhm.
review before the board meeting. That's on the 16th, which is
Okay.
a week
All
from
right.
Thursday.
Want to make sure we're all clear on that.
Oh, excuse me, Cheryl, and
Go
Mimi,
ahead, Rich.
if it goes to the board for a week from Thursday, do you still extending an invitation for others of us to appear at that meeting as well, in person in
Oh,
Salem?
yes, well, personally, I would love that. I hope you will, because I would certainly defer to you
Always.
for details. I would phone a friend. So,
Yeah.
yeah,
Okay,
yeah,
I'll be there. Thank you.
great. So with that, given the timeline and what you know about the small corrections or clarifications, I'd like to ask for a motion to submit this preliminary proposal to the board. Do I have a motion?
I will motion.
Oh, second.
Okay, and Charlie seconds it. Thank you. Any discussion?
Yeah, I take, we've had consistent feedback from knowledgeable people that the employer payroll tax credit is unfair. And right now, I mean, I wrote that text talking about if there's an employer without the employer tax credit, I believe that employees pay twice because they take decreased wages because their employer is paying the payroll tax, and that's one, and then they pay on the income tax, and that's twice. So they're paying for it twice. So I still believe in it, but I also feel that that I want to look at the individual scenarios with and without the credit and say, does that make sense? I don't think I don't want it to hold up this this going to the board, but I do want to come back and look at that when I write when when we have pictures of scenarios from Charlie's worksheet to look at and maybe revisit that or amplify it some. But I take those objections seriously, and I want to take a look at that. But thank you.
Is this a concern that we could add to the proposal? I don't know, I'm asking Will right now. Somewhere.
It makes a big financial difference. It's not like it's in the weeds. I'd waive off the
Right,
consumption taxes right now because that's small potatoes really. But the whole credit thing has big changes, and we need to take that very seriously and under due deliberation.
This is Morgan. I think in Charlie, you should jump in here. I think it's fine to, raise within that memo some areas for consideration and further exploration, right? I think what we're trying to signal to the board here is like, this is our best thinking today, but we still have
Right.
questions we're trying to answer. I think that's perfectly legitimate. So
Yeah, I think that makes a lot of sense. Yeah. Okay, Charlie.
Yeah, I agree that I think we should bring it up. I fully intend to keep looking at scenarios or tax structures with the credit, without the credit, and probably a middle ground of credit, and see what effect that has. So I will definitely continue. I mean, the scenario thing I sent out has that in it already, but I will continue to do that and refine it and look at those possibilities with a bunch of different scenarios. And I guess the other thing that I think is worth exploring, but I'm not quite sure how much to explore it yet until we have some more data, is changing the firm threshold. And that is going to depend, I guess, to judge the fairness of that or the effect of that. That's going to depend upon some more data that I hope we can get, that I think Will and Morgan might be looking for, and we'll see if we can get some data that can help us judge the effect of that. The other question, or another question, which I think is directly related and was brought up by the same two people again, is the exemption of a small portion of the 100% of federal poverty level of wages from the tax. And I think there's a very useful comment that Will put in of how that can help companies that tend to hire seasonal workers and other part-time workers for a variety of reasons. So I think it might be worth looking into, but I think we need to be really careful about what effect that has on various sectors of the economy where there are a lot of seasonal workers. So.
Okay, thanks, Charlie. Richard?
The biggest single change that I see in this proposal from the status quo, from the point of view of businesses, is for those businesses that don't currently contribute anything towards their employers and employees' healthcare. And I'd like to see from our consultants with my work in as well, but I'd like to see what that means, because I'm really concerned, as Alex pointed out, that small firms are going to look at that and say, whoa, I didn't have any of this cost in there before, and now you've just added, I'm just making it up, 10% to my cost of goods sold, and I can't make it in my market. And I take that seriously, and that's the single biggest change that I see in the Oregon. I think it's fairer under the new plan, but that really the issue is will small business accept that? Again, this is all iterative. We've done so much great work, and one of the iterations is to come back and say, for each of the people that pay individuals and big businesses and small business, what's it look like? So I'm not saying that we haven't planned to do that work, but that's a big change that that I need to work through. I still think as an interim step, we should send this to the board because they haven't had anything to Bethany's point. But that small business, I'm really concerned about. Thank you.
Richard, are you saying we should mention this though, like as a heads up in the next iteration or something like that in the proposal, or no?
Well, a careful reading, I think people will see that, but again, in full
Not careful
transparency, I
reading.
think it's fine to mention that, yeah.
Mhm.
Call people's attention to what's a change.
Okay. Is that doable, Will, in the next couple of days?
I think so. I think
Thank
so. I would definitely benefit from Richard's ELI and reviewing the text. And Charlie.
Okay, sounds good. Thank you for that suggestion. Charlie?
Well, I agree that that is the biggest change. Also, a very big change, almost as big perhaps, is that business will be paying a whole lot more for high-income employees than they do now, and a whole lot less for low-income employees. And so that is also a very, very large change from what's currently going on.
And
And
is
again,
that
I still think we should put it forward.
okay, yeah, and is that another thing to mention, like, for us
I
to
think
think
it's worth
about in
mentioning.
consideration?
Yeah.
Yeah. Okay. So with that, I'd like to call the vote, and I wonder if we should do roll call. What do you think, Mimi? Yeah, okay.
Yes, please.
So we're going to ask you if you're in favor of submitting this preliminary proposal to the board for the board to consider at the next board meeting on October 16th. So when your name is called, say either yay or nay. Okay, go ahead, Isabel.
All right, Cheryl Ramirez.
Yay. Or aye.
Shenwei Chi is absent. Mary Lou Henrich?
Henrich, no.
No. Richard Gibson?
Yes.
Jeff Goodman?
No.
John Santa is absent. Bethany Stairs?
Yes.
And Charlie Swanson.
Yes.
Okay, so that's 4 yes, 2 no's, and 2 absents. So I think we'd need a 5 to pass, correct?
That would be the quorum. Yeah, that
Yeah,
would be
we have a
majority.
quorum, so this
But
could,
we
you
have
can have a
quorum.
majority.
So it's okay that we have 2 who are absent who aren't voting.
Okay, got
We
it.
do have the majority. Okay. So the vote passes, and I would say, well, we have time during the board meeting to talk about, concerns and things, and I would imagine, Mary Lou, you'll bring up concerns. Yeah. Okay. All right. So with that, I think we've completed what we were going to do today. I do know, as Morgan mentioned, there's a lot of, I would say, deep diving work that needs to be done in between this meeting today and our meeting in November. And I think they need the time to work on all of that, all of those extra things that they were mentioning they would do. And probably with Charlie's and Richard's work, I believe you got called out. So my suggestion is that we don't have a second meeting this month, to give them the time that they need to work on again another version of the proposal, and maybe a more detailed version. So that's my suggestion to the committee, but like to hear from you, Mary Lou.
Well, I'm kind of thinking that in the opposite direction, that to have the meeting where we can go over and talk about what the board did or didn't do or said or whatever, without, a lot of more information necessarily. But I just think to kind of think, how do we go from here or there, or what didn't they understand, or what did they want more of, or I don't know. I'm just feeling like a whole month before we get back as a group to respond to that, it might be kind of cold.
Others have opinions? You would agree with getting together
Yes.
in October? Charlie?
Now, our regularly scheduled October's secondary meeting would be before the board meeting, so it wouldn't help. So we'd have to do it on a
No.
special day, wouldn't it? Isn't that right? Or
It's the 21st. So it'd be
Oh, it's
this
the 21st.
It's
Oh,
right after
oh.
it.
after. Mhm.
Oh, right. Oh, actually, then I'm in favor of that as well. Then I was thinking it was going to be before it, but okay.
Okay, I just want
Yeah.
to check in with Echo Northwest, how you're managing your workload and if that works for you.
Uh, I would think if it's a meeting just dedicated to discussion feedback from the board, that can probably be pretty lightly facilitated, and then we can continue to work on the pieces that we're working on, not be sort of on board to have to prep for the end.
Right. Okay.
So I think
Yeah.
that if that's the agenda item, I
Yeah.
think we can
If
accommodate.
we hold it to that, yes, and don't expect you to present any new information, material and all that. Okay. Mimi, I just want to defer to you too. Your thoughts.
We're here to serve.
Politically correct.
Okay. All right. So we'll keep the meeting on the 21st and just have that one agenda item.
And it could be just 10 to noon. I don't think we need, you know.
No, we don't have
It is
hours.
scheduled 10 to noon.
10 to noon. Okay, great. Okay.
Okay, so I think we're on to meeting reflections and we already have our next meeting topic, so we've got that covered. Is there, I mean, I think we've been reflecting on the meeting, obviously, leading up to the vote, but is there anything else people would like to talk about on the meeting?
I guess I just want to say that even though I voted no, you know, it was on the line. So I mean, it's not like I'm really upset that we did this. It's just more, I felt I wanted to kind of be true to my conscience and say what I had thought and to reflect it in my vote. But you know, I don't want to be seen as that I wasn't with the group.
Believe me, I understand your trepidation. This is a lot. Charlie?
And it's good that Mary Lou is a board member as well, because then she can explain her thinking about, well, this is where we are now, and it's pretty temporary, but we're looking at other things, et cetera. So I think it's a good thing that she is going to be part of it.
Yeah.
Yes, I agree.
And you too, Cheryl. Yeah.
Yes. Jeff?
I have an easy one. I just want to confirm. October 21st, 10 to 12. Next meeting?
Yes, that's right.
Okay, thank you.
That was super easy.
Yeah.
Okay,
Well,
I don't know, Mimi, did you have anything else that you would like to discuss in this section?
No, I'm not sure. We'll just see if Isabel, if we have any public comments for this portion of the meeting.
I did not have additional signups unless well, Alex did sign up today, so I don't know if we're gonna
Looks like he's got his hand raised.
Yeah. I can just give you 1 second to give you permissions. There we go.
Hi again. Thanks again for your work. Just real quickly, it's kind of wordsmithing, but something I would like you to at least consider. You know, originally but going back to the task force trying to sell UHP, you talk about, you know, no fees at point of service, you know, and no co-pays, no deductibles, and no premiums. And now you're instituting something called a premium, which I saw in some other comments you're getting pushback on. So just as an option, maybe you could call that something different, like a household contribution or household assessment, something like that, because a lot of people are going to see premium and think, oh, well, you know, so the only difference is now I'm paying premiums to the state instead of my insurance company. And anyway, I think you might consider some other kind of
language,
some other kind of assignment to that particular fee. Thank you.
Thanks, Alex.
And then Linda, I also saw your hand.
Can you hear me?
Yes.
We can.
Thank you. Yeah, I just wanted to go back and reiterate that even with the corrections that were made, the Nike executive still pays zero, who makes $250,000, still makes zero contribution with the tax credit. And the small business employee who makes $55,000 still contributes $6,133 a year.
Yeah, but could I respond to that? Because I take this very seriously, but the Nike employee, their employer paid a large amount, on the order of $25,000 toward that employee's health care. And if we look at the idea, if we consider the idea that a benefit is wages that would otherwise have gone to that employee did pay for their health care. So,
no, because those wages, that wouldn't have gone to them in wages. That would have been paid to Pacific Source for a healthcare premium.
But either way, either as a premium or as a payroll tax, those things that the employer had to pay for in the absence of those other programs the concept would have gone to that employee in terms of a higher wage. And that's a well-established concept. So that's where the challenge is with this.
Right, but it doesn't take into account the fact that today the Nike executive pays some portion of their health insurance premium, and under this program they would pay zero.
Interesting.
No, they still would pay the personal premium. Remember, the payroll tax is a credit against the healthcare personal income tax, not the premium portion.
Not the premium, only the HCPIT.
Correct.
So they would pay about $2,000 versus $6,000 for the small business employee. The double taxation thing, I think, is a little bit of a red herring, I have to say, because they wouldn't pay that total amount in taxes. So even if, they wouldn't pay that $25,000.
But their employer paid it. And in the absence of healthcare at all, that employer would have gotten an extra $25,000 in wages that year. That's the concept.
Maybe.
Okay.
Maybe. And yeah.
Okay.
And it raises the rates for everybody else who's not a wage earner at a large business, because the small business employee now has to pay more. Their rate has to be higher so that Nike executive can get that credit.
Thank you for your comment, Linda. Did you have anything else that you wanted to say?
No.
No. Looks like
Linda, could I ask that is your comment really about should there be a cap on the credit?
Well, I guess my comment is really that if we're going to present something to the board or to anybody that talks about this tax credit, and we present the whole picture, that the tax credit causes both the employer payroll tax and the individual income tax to have to be higher, and the individual PPP to have to be higher in order to make up the difference of that. And what does that do to people who are working for large employers versus people who are working for small employers, or people who are self-employed, or people who are getting their income through other sources? It shows one side of that picture. We're talking about one piece, and I think we're giving it an outsized impact. I have yet to see something that shows the actual impact of it. If I got that money in my paycheck, even if I did, how would that double tax? How is that double tax different?
If I could just jump in, I apologize, and I so appreciate all of your comments, Lemma, but just to keep it fair for other people who've made comments, if we could we'll kind of end the public comment part now. I apologize. I don't want to cut you off.
I was just answering the question.
Yes, but just to kind of continue, I think now it is fine for the committee members. Apologies. Thank you so much, Linda.
Thank you. And Charlie has his hand raised. I have a feeling you were going to address some comments.
I actually wanted to address a little bit. So I will continue to put in, and I'll create some scenarios that, a variety of choices of how much the credit could be. And I'll share that with Linda to see what she thinks. And so part of the issue is going to be, what about people who don't have who make money that is not wages, and are we going to get enough money from them? And the answer in my mind is, if we don't do quite a bit of that credit, we won't get enough from anybody else. We're going to get almost all of it from people who make wages and not from those who have income from other sources. So to me, there's a number of fairness issues in there. But I do think that one of the things that Richard mentioned, putting a cap on that credit, is something to look at, but it might be easier just to put it as a, don't do 100% credit, do a smaller percentage credit. So there's going to be a real difference if you don't do the credit in how much comes from modest income people who make money from wages and modest income from people who get money from other sources. So
Thank you for doing some more thinking about that, Charlie. So with that, any other business for the committee today before we adjourn? Mimi, I'll give you the last word in case you have anything else.
Oh, no. I'm just, again, grateful as always for the incredible work of our committee members. Truly, for the members of the public, we really do appreciate all of your comments and insights. And then, of course, for our consultant groups who are instrumental in making this happen. And I will, if we're going to, we'll end this meeting, and then for some of the our Echo Northwest team will meet with you in our Zoom room, just to remind you, right after this meeting.
And I'll just echo the thanks to the committee, to Echo Northwest, to the public who really care about us getting this right. I really appreciate all of you. So thank you, and we are adjourned.
Thank you. Thank you, Cheryl.
Bye-bye.
Be well.
Thank you. Bye.